Disease Control has made a major announcement when it comes to the flu vaccine and your children.
One that may have you rethinking what vaccination to get. Kenneth Craig has the details.
Many kids around the U.S. will have to feel the sting of the flu shot this fall. A CDC advisory committee has voted that the nasal spray vaccine, Flu Mist, should not be used in the upcoming flu season.
2 of the last 3 seasons, it hasn't worked at all, at least in our hands. We haven't seen any of our data that indicates the vaccine has been effective. On the other hand, the flu shot has been effective.
It's estimated that about 1/3 of children get the nasal spray vaccine each year. Earlier data found the nasal spray was actually more protective than shots for young children. Health officials don't know why the spray isn't as effective now. Many hospitals and doctors have already placed their orders for flu vaccine. Experts say that may be a challenge this fall.
I think it may be that a doctor has to call 1 or 2 places to make sure they get the vaccine they need, but I think overall there won't be any shortages.
The makers of the nasal spray say the CDC's effectiveness data contrasts with studies done by AstraZeneca as well as other findings. The company says it's working with the CDC. Federal health officials hope parents won't be discouraged and continue having their children vaccinated, reminding that it's better to get the flu shot than the flu itself. Kenneth Craig, CBS News, New York.
And estimates show the nasal spray accounts for less than 10% of the flu vaccine supply every year.
And joining us today is Dr. Tom Murwin from Dean St. Mary's. Dr. Murwin, good to see you. Thanks for coming today.
Thanks for having me.
Now, this is very confusing because I thought in the past the flu mist was thought to be more effective than the flu shot.
So the flu mist was thought to be as effective as the flu shot. And if you give the child a choice, most of them would choose a non-shot versus a shot. And that's where the popularity of the flu mist is you don't have to get a shot. So it's, we think, a lot more uptake in the preteens and the teens who want to get, can potentially tell us that.
Right.
Did it surprise you today?
It did. We didn't, with the initial studies showed that the vaccine was equally effective, but in the last 2 to 3 years, the studies have shown that the nasal vaccine is only 3% effective, and the shot is 63% effective.
Well, that's a significant difference.
We're not gonna give a vaccine that isn't effective. So the recommendation going forward for this year is everybody gets the shot. There's really no reason to give the ineffective nasal flu vaccine.
It is very disappointing, though, I'm sure, for a lot of parents, because I remember when my son was a toddler, he was terrified of vaccination.
But the shot is the best defense we have against the influenza, which kills 50 to 150 kids every year. And we're just trying to protect them so that they're not part of that statistic.
So this year's shot has already been formulated.
Yep.
How did they decide what goes in there?
They have very smart people who look at the pattern of how the flu travels not only around the upper northern hemisphere, but the southern hemisphere and how it circulates between the two to try to predict what's coming. We don't have a perfect model, but we have a pretty good model that can some years predict it very well and some years not as well.
How confident are you that this study is accurate? Because sometimes we have a tendency to say coffee is bad for you, coffee is good for you.
Red wine's good for you.
Right, so
that's the beauty of science, is eventually we get to the right answer. But like democracy, we sometimes have some detours that we take. So the latest data is all that we can say. That the last 2 to 4 years, the shot has been much more effective than the nasal flu vaccine. As we get more data, we may change that recommendation. So it's a year-to-year recommendation.
So what's your message to parents about all of this? You have to get a shot.
I said the same thing to my kids. You have to get a shot this year because the flu nasal spray is not effective. So.
But is the flu nasal spray still available? Can you still get the nasal spray?
Well, we've ordered some, just like everybody else has ordered some. 8% of the vaccine last year was given as nasal vaccine. So it's still available. And somebody might say to us, I do not want a shot, give me the nose spray. And that's still available to be used.
But as a doctor, how would you feel about that?
Right, that's difficult.
I would just look at them and say, my kids aren't getting the nose spray this year because it's not effective. So I'm going to give them something that's effective. They don't like shots any more than anybody else. So
roll up the sleeve.
Yep.
Doctor, thanks for being with us today.
Great to see you, Tom. Thanks for coming today.
And we'll be right back.